Okay, so hi, I'm Dr. Shen Chen. It's Saturday, after work, we got 6 minutes. Let's learn something. Today I'm going to talk about veneers with Chairside CADCAM. Now to get started, let's ask a very simple question first. What exactly is a veneer? A lot of people, when they hear the word veneer, they imagine something like this. So something delicate and thin and not very invasive, probably used for the aesthetics in the anterior region. But this is actually not a typical veneer. So far, I've placed over 1,000 veneers and they all basically fall under one of these three types. They're either a true veneer, an open contact veneer, or a full coverage veneer. Now I'm going to briefly go through all these. The first type, the true veneers, only cover the buccal surface and the incisal edge. With these types of veneers, you really can be quite conservative in preparation, and these are the ideal types that we want to do. The second type is a veneer with both incisal and proximal involvement. Now these types of veneers have two primary issues usually. One is that you invariably have to remove more dentin and more enamel. It's just unavoidable. The other issue is that the path of insertion sometimes needs to be more carefully considered, especially if you're doing multiple veneers at the same time. The third and the last type is a full coverage veneer, otherwise known as a crown. I tend to think of crowns as a last resort, for situations when veneers are not possible. So then naturally, the next question is, when are veneers possible? And of course, when are they not possible? For instance, a tooth with previous endodontic treatment is probably better off with a crown than a veneer. Teeth with previous crowns would also need new crowns because veneers are simply not possible. And teeth that were subjected to trauma may need temporary crowns in possible endodontics, but this is not always the case. Sometimes it's still possible to restore with the veneers. It really just depends on the geometry of the fracture. So assuming that our patient's teeth has no previous endo, no previous crown, and no previous trauma, now I typically do a 3-step evaluation to see how conservative I can be with my veneer. And the 3 evaluations are change in appearance, bite abnormality, and caries involvement. So for the change in appearance, I ask myself, am I closing a diastema? Am I filling a black triangle? Or am I making big changes to the color of the teeth? If yes, then I might need to open up the contacts. In this case, you can see 2 different situations where I've opened up the contacts, here and here, and where I've left it closed. The second evaluation is for bite abnormality. Now, does the patient have deep bite? Or does he or she have malocclusion? Does the patient also show signs of bruxism and other parafunctions? If they do, like this patient with a deep bite and is a bruxer, you can sometimes get away with veneers and a night guard, but for the most part, crowns are a safer choice. The last evaluation is for caries involvement, especially in the proximal area. Since we don't want our veneer margins to be on resin, if there is proximal caries, then we need to open up the contacts, like in this case. So now that we know the different kinds of veneers and when to do them, how does the digital workflow work? When I've decided on the kind of veneers that I want to do, after preparation, I can scan this with an intraoral scanner and get a virtual copy. But before I send this file to our dental technician for design, it's always a good idea to check a few important parts of the prep. For example, do I have good and smooth margins? Or have I gone far enough lingually after opening the contacts? Have I done a smooth transition where the proximal and the incisal edges meet? Once everything is checked and we have our file ready, we can start the design process. For this patient, her original lateral was actually a good reference for our design, although we needed to change a bit to close the diastema. Looking at these design files, sometimes it's a little bit difficult to gauge whether the design is good or bad, and so we need a few parameters that we need to meet. The first parameter that we should consider is whether we've met the minimal thickness of the ceramic. So we can set it to be really thick, or we can set it to be really thin. And it really just depends on the kind of ceramic that you have and also the shade of the final restoration. The second parameter that we should check is for spacer thickness. Again, you can set this to be really thick, or you can set it to be really thin and very tight. Normally we want the spacer to be as thin as possible, but it also depends on the kind of resin cement that you have and the quality of the preparation that you have. So you need a good quality preparation to have a very small spacer thickness. As a last example of the kind of parameters that we often set, margin thickness is where we leave an overhang of extra ceramic near the margins so that in the event that it chips, we don't compromise our integrity. And how we set these parameters will be based on clinical findings. And once everything is set, we're ready for milling. The milling machine takes about 15 minutes or so to produce a crown or a veneer. And then we need to follow it with some post-processing. So the first step is to retrieve the restoration from the block, followed by a bit of contouring, a bit of staining, and a little bit of glazing. And about 2 hours later, we have a brand new veneer and a satisfied patient. The design for this case was handled by Sharon, our dental technician pictured here, thinking about eating a piece of ceramic. So to sum up, I've talked about the types of veneers and the clinical decisions behind them, and also an overview of the digital workflow for veneers. And we've come to the end. So I hope this video was a little bit helpful to some of you. With the current virus situation, it looks like we're in it together for the long haul, so I figured that we might as well learn something in the meantime. I'm Dr. Shen Chen. Thank you for listening and have a great day.